To our Facts Not Fear coverage of COVID-19, and Ohio's case numbers are on the rise. Take a look at our moving average graph here. We're now seeing an average of 300 new cases a day after a few days of steady increases. And today we saw more than 400 new cases, along with 44 new hospitalizations and a positivity rate of 1.7%. Now, these increases come as the entire country is seeing increases in cases due to that Delta variant becoming the dominant strain nationwide. Now, the key to fighting it off is vaccination. But as 10 TV's Angela Reigert reports, that's easier said than done.
The Delta variant is, in fact, rapidly increasing and is on a trajectory to become the dominant strain in Ohio.
On the same day, Ohio health leaders warned of the risks of the Delta variant and urged vaccinations.
When there are more people who are vaccinated, there are fewer people who can carry this virus.
Governor DeWine signed a bill banning public schools and universities from requiring vaccines not granted full approval by the FDA. It specifically targets the COVID-19 vaccines, which have emergency use authorization. Dr. Andrew Thomas is the chief clinical officer at OSU Wexner Medical Center.
In a way, vaccine providers or employers or schools would not be able to mandate the use of that vaccine under the federal rules for the EUA status. So in a way, I think once that EUA status goes away, from my understanding of the legislation, those restrictions on mandating the vaccine would also go away.
Right now, about 45% of the state is fully vaccinated. As for the Delta variant, we know between May 23rd and June 5th, Ohio health officials detected it in nearly 2% of the samples they tested. Between June 6th and 19th, that number jumped to 15%. We're told it's likely to double in the next round of results.
We now have two Ohio's, an Ohio that is vaccinated and protected on the one hand, and an Ohio that is unvaccinated and vulnerable to Delta on the other.
The fear is the variant will keep spreading if more people don't roll up their sleeves. Now the focus turns to the fall with students back to school.
I think the Ohio Department of Health is working with the Ohio Department of Education to put out some guidance related to that. I'm not able to speak about that today, but I do think it will probably relate to those that are under age 12 needing to be masked to some degree when they're around other people.
Reporting in Columbus, Angela Reigert, 10 TV News.
Governor DeWine says he will soon announce a new vaccine incentive program for the state that's likely to focus on giving smaller amounts of money to more people.